For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Today we have Dr. Pat Brawley from Women's Cancer Care here to talk about women's health and cervical cancer. Welcome, Dr. Brawley.
Thank you, Amanda.
Can you first give us a little bit about your background?
Sure. My training is in OBGYN, so I'm an OBGYN doctor who then did extra 3 more years of training to do GYN cancer treatment and evaluation for patients. During that time, I actually did all my training in California, the University of California, Irvine, and got here because I was recruited to be at LSU, where I was chief of GYN oncology for about 6 years. I then went out into private practice and have been affiliated with St. Tammany Hospital all that time.
Okay, great. Well, I think most women know that kind of one of the main tests we get to test for any women's issues is a pap smear. So can you talk a little bit about what that is and what it checks for?
Sure, and there is a lot of misconception about what a pap smear is and what it checks for, so this is a good place to start. A pap smear is a screening test, and the definition of a screening test is a test that's done in a population that is at average risk for something, whether it could be cancer, like the pap smear or mammogram, or whether it could be some other test checking maybe a chest x-ray or an EKG to look for issues with heart disease. So a screening test is done, and everybody says the pap smear is done to find cervical cancer. Really, that's not the goal. The goal of a pap smear is to find cells that are abnormal before they become cancer. Okay. And so a pap smear is actually one of the more powerful screening tests in that it has the ability, ideally, to prevent the cancer it's screening for. That's better than mammograms, for example, save lives related to breast cancer by picking up a breast cancer before it can be felt. But a pap smear can actually prevent cervical cancer, and so that's the goal of having a pap smear done.
Okay, and so who should have one and how often?
Okay, there's been a lot of evolution of what the recommendations are for pap smears. In the old days, 10, 15, 20 years ago, the recommendation, and everybody kind of understood it, was to have a pap smear every year. Mm-hmm. I am still in favor of more frequent pap smears than the guidelines, but now there are official guidelines that have been adopted by the American Cancer Society, American College of OBGYN, and National Cancer Institute, and many other organizations that say pap smears should not be started before age 21, and then we should do a pap smear every 3 years to age 30. And after age 30, we can actually add in a test for HPV, which makes the pap smear more effective. And if we do that, then we should only be doing pap smears every 5 years. Oh, wow. Now, again, we had problems even when we were recommending annual pap smears, and most patients didn't come every year. Right. I think one study was done, and they said that if somebody thought they were getting annual pap smears, but they went back and looked at the dates, it was more like 18 to 20 months in between pap smears done every year. Mm-hmm. So you can imagine when we tell somebody to come once every 3 years or every 5 years, it's probably going to end up being sort of like colonoscopy, where you said, well, I think it was 5 years ago, and you look and it was before Katrina or something like that. So the guidelines are there. Patients think sometimes, and doctors think sometimes, that the guidelines are what's best for the patient. In my bias as a GYN cancer doctor, because I see cancers even in patients that are getting pap smears, My bias is the guidelines are what's good for society. They're what's cost effective, but not necessarily the ideal thing for the patient. But those are the official guidelines that are out and what many patients will be told by their doctor.
Okay. So you said that it was used to diagnose things before cancer is caused. Is that what's also used to diagnose cervical cancer?
Okay, so actually technically the diagnosis of cervical cancer should be done with a biopsy.
Okay.
So the pap smear is a method of scraping cells off the surface of the cervix. They're then fixed in a special fixative and put on a slide and looked at by the pathologist to look for any early changes that, that the cell is abnormal, but hopefully not yet cancer. And there are different levels of abnormality. So we can have a pap smear that's normal. We can have a pap smear result that says low-grade lesion or high-grade lesion and then cancer. So certainly our goal is pick up these abnormal cells when they're a high-grade lesion, but before they have become invasive cancer. If a pap smear does say is a significant abnormality, such as a high-grade lesion, or even if it says cancer, the next step is a procedure called colposcopy, where we look at the cervix with magnification. We actually put a vinegar solution on the cervix that helps us to see abnormal areas, and then we get a biopsy of the area that looks the worst. And that's the way we make actually a diagnosis of cervical cancer.
Okay, so if you get an abnormal pap smear, it doesn't automatically mean you have cancer?
Absolutely not. And the huge majority of abnormal pap smears are not cancer.
Okay, and if you do have one, do you need to get another one sooner? Like what happens after that?
Yes, that's a good question. So it depends on the level of abnormality and depends on patient's age and a lot of different things. But if we diagnose or if we get a pap smear that's abnormal, the patient has a colposcopy and a biopsy, and maybe they have dysplasia, moderate or severe dysplasia. Typically, those patients will be treated, and they'll have either freezing was kind of the old-fashioned treatment, laser or excision removal of those abnormal cells. Certainly then the patient needs to be followed, and a repeat pap smear might be done in 3 months or it might be done in 6 months. It certainly wouldn't be 5 years for the next pap smear.
Okay. And so if you have a normal result, does that mean there's no cancer?
Okay, and that's a good question too, and that's a misconception. So a pap smear, like any other test you can think of, is not perfect. And with the pap smears, the technology that we use today, a pap smear is about 70% effective in picking up cervical cancer or precancer, ideally. And so in many instances, we actually add another test called an HPV test to the pap smear, and then that significantly improves the sensitivity. But we do about a third of patients in the United States that are diagnosed with cervical cancer have had a normal pap smear within the last, say, 3 years prior to their diagnosis.
Okay, and are there other symptoms that women can look for cervical cancer?
Yes, absolutely. So, well, like most cancers, early cervical cancer probably doesn't have any symptoms, but as it grows and becomes a visible lesion on the cervix, one of the most common complaints is abnormal bleeding. And there are different patterns of, certainly a lot of people have abnormal bleeding that don't have cancer. If a patient has spotting or bleeding after intercourse, that's called postcoital bleeding, that is of some concern. Patient could have some sort of watery discharge. Advanced cervical cancer could be associated with pain. And actually many patients say, well, how could I have cancer? I don't have any pain. But pain is really more a sign of late cancer. And the typical pain that a patient with cervical cancer might experience is hip pain, usually one or the other hip, kind of sciatic pain, where pain radiates down the back of the leg. Now, obviously, many patients that have that pain don't have cervical cancer,
exactly.
Because that can be from a herniated disc or other things too.
Okay, and what about women who have hysterectomies or any sort of things like that? Do they still need to get tested for cervical cancer?
Good question. There's a lot of misconception about that. So it depends on why you have the hysterectomy done, and it depends on your prior history. So let's say a patient is 40 years old and they've had abnormal pap smears and had maybe severe dysplasia. They were treated and it came back, and they opted to have a hysterectomy at that point. That patient still needs to have pap smears done because of her history of an abnormal pap smear before. And actually the American College of OBGYN recommendation is that patient continues to have pap smears for 20 years after they've been treated. If you've never had abnormal pap smears and you have a hysterectomy for fibroids or painful periods or something like that, the guidelines say you don't need pap smears. Now what I would add to that, and again this is my bias because I see exceptions to the rule often, I would say if you have a hysterectomy for a benign indication, never had abnormal pap smears, and if you have a vaginal pap smear that shows no HPV, then you're probably pretty safe and likely don't need to have pap smears unless you have symptoms that are worrisome.
And is there an age where people no longer need to get pap smears?
Yeah, and again, this is another guideline that I don't love. But the official guideline says that after age 65, you don't need to have pap smears, and it just says that. Like we shouldn't do pap smears after age 65. There's then a disclaimer, well, that is unless you had abnormal pap smears in the past, or if you didn't have adequate screening in the past. So a patient that maybe had a pap smear when they were 40 and they had their tubes tied, and then they get to be 65 and they come in, and somebody says, well, you're 65, you don't need a pap smear. When you dig deeper into the guidelines, it says if you have to have had 3 consecutive normal pap smears in maybe the last 5 or 10 years, and not have had any history of abnormal pap smears or precancer or cancer that needed treatment.
Okay.
So, but everybody hears that, that I'm 65, so I don't need pap smears. And then the other thing that is a little bit of a challenge is Medicare only pays for just routine screening pap smears every 2 years. So when you see that combination of that guideline plus Medicare, older women think they don't have to have pap smears. The problem is the older we get, the more likely we develop cervical cancer.
Okay.
And so that's again where the guideline is based on what's cost effective to society, not necessarily what's best for the patient.
Okay. And then do you get a pap smear every time you have a pelvic exam?
There's a lot of misconception about that too, and the answer is no. So a patient that goes into the emergency room, let's say is having abnormal bleeding and has an exam, pelvic exam, they then come to see me and I say, when was your last pap smear? And they say, oh, when I was in the emergency room. And I said, no. I have never heard of a patient getting a pap smear in the emergency room. It just doesn't happen. Now they could get a biopsy, they certainly could get a pelvic exam, but pelvic exams can certainly be done without a pap smear.
Okay. All right, well thank you. I appreciate all of that. When we come back with Dr. Brawley, we'll talk a little bit more detail about HPV and how that can affect women.
Thank you. Thanks. Thank you. Thanks for Sunny Face Eggs. For my baby sister.
For my fishing buddy.
Thanks for my mama's gumbo. Thanks for my mom.
We enjoy receiving awards and recognition from our peers, but the true reward comes from seeing positive outcomes for our friends and neighbors. So thank you for trusting us. St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We're back with Dr. Pat Brawley to talk a little bit about HPV and how it affects women. Welcome back, Dr. Brawley.
Thank you.
I guess first let's start with what is HPV?
Okay, so HPV is human papillomavirus. And this is a virus, sort of like HIV virus or shingles or different viruses that can cause illness and in patients. So human papillomavirus is actually a very big group of viruses. There's over 150 types of HPV.
Wow.
It is incredibly common. We believe that 80% of men and women have or have had HPV by the time they're 50 years of age. So basically, any patient, male or female, who has ever been sexually active very likely has had or currently still does have HPV. It is the most common STD, and there are about 80 million people in the United States that have HPV. Basically about 1 in 4, out of every 4 people you run into, one of them probably statistically has HPV, so very common.
Wow, okay. And is it only transmitted sexually?
No, kind of yes and no. No, in that there are many of the 150 types of HPV, many of them, over 100 actually, preferentially infect what's called cutaneous epithelium, so skin on your hands or feet. So when kids come home from kindergarten with warts on their fingers, that's HPV. Okay. And that is transmitted, basically the HPV is transmitted by close skin-to-skin contact. So the HPV, the virus that causes warts on your hands, is probably kids pass that when they're playing Ring Around the Rosie, or they're holding hands, or they're climbing on jungle gym together, things like that. About 40 types of HPV preferentially infect what's called mucosal epithelium. That would be the skin in our mouths, in the vagina, in the anus, and some of the outer genitalia. That also is passed by close skin-to-skin contact, but it does not require vaginal penetration, intercourse, in order to be transmitted. It could be oral intercourse, it can be manipulation.
Okay. And so I guess we hear a lot about HPV and getting vaccines and that sort of thing, but does that cover all the types? Because it sounds like some aren't as bad as others and that sort of thing.
That is absolutely true. So of the 40 types of HPV that preferentially infect the genital tract, and now we're finding the mouth also, some of them are what are called low-risk HPV and some high-risk. So low-risk HPV causes warts, and it can cause abnormal pap smears, but not abnormal pap smears that are going to turn into cancer. It is only high-risk HPV that causes cancer. And we've known for years that high-risk HPV causes cervical cancer. We're now realizing it causes other cancers too. So it causes cancer of the vagina and vulva. It causes cancer of the anus in men and women, penile cancer, which is actually very rare. And we're now finding more and more oropharyngeal or head and neck cancers that are being caused by HPV. So cancer of the tongue and tonsils is, there's a very high incidence, rapidly increasing numbers that we see in young patients that don't smoke and don't drink or chew tobacco, which was the risk factor before. Now there are more of these cancers caused by HPV than the other risk factors.
Okay, and so what are the symptoms of HPV?
Well, and if you don't have warts, there are no symptoms. And that's what's a little bit scary. So I said 1 in 4 people have HPV. The huge majority of them don't know that. And then the challenge is, you could say, well, could I go get tested for it? And if a patient, male or female, comes in and says, I want to be checked for STDs, HPV is not one of the tests that's done. Okay. We check for syphilis and chlamydia and some other tests, gonorrhea, but not HPV. When we test for HPV, we're testing for it to identify patients that are at high risk for cancer, not testing it like it's an STD. Gotcha. And there is no recommended or approved test for men. It's only for women in the setting of pap smears.
Okay. And so I guess there isn't, how do you know if you have it?
Well, so a woman could know it based on her pap smear result, or a man or a woman could know it based on the fact that they have genital warts. Okay. But the warts, like I said, are caused by HPV that's called low-risk HPV. So warts don't mean you're at any increased risk of getting cancer. Okay. It just means you have a low-risk HPV.
Okay, and what is the treatment for that?
So warts are treated with well, often they'll go away on their own. But if they don't go away or they're bothering the patient, they can be treated with, there's a cream that can be used, there's acid that we can carefully drop onto the wart, or we can laser them or freeze them.
Okay. And so what can be done to prevent HPV?
The best thing for preventing HPV transmission is vaccination. There used to be 3 different vaccines on the market. There now is only one. It's made by a company called Merck, and the name of the vaccine is called Gardasil 9. The original HPV vaccines were introduced in 2006, I think. And it was in about 2016 that the Gardasil 9 became the only vaccine on the market. It, as the name implies, covers 9 types of HPV. It covers the 2 types that cause warts, that cause most warts, and then 7 high-risk types that cause cancer. Ideally, the recommendation is that all young boys and girls at the ages of 11 and 12 get the vaccine. And if children do get the vaccine at an age under 15, they only need 2 doses of the vaccine. Many patients were, the vaccine wasn't around, or they didn't get it when they were 11 or 12, and maybe they come in, and maybe it's a young woman comes in and she's 20 or 22 and is concerned, or maybe even has an abnormal pap smear. At that point, women the vaccine is now approved up to age 45. Okay. For men, it's approved only up to age 22 unless they're high risk. So a homosexual male or somebody with a immune system that's not that's not real strong. Those men can also get the vaccine up to age 27.
Okay. And is the vaccine safe? I know we hear a lot of disputes about that in the news and things like that.
There are a lot of anti-vaccinators, and we're seeing the challenge with that with the measles vaccine right now and the outbreak of measles. The HPV vaccine is very safe. One of the challenges with all the vaccines is that there is a reporting system to report if somebody has a side effect from a vaccine. This is a publicly maintained and accessible website run by the CDC, and so if a young girl gets the HPV vaccine and 2 weeks later is in an accident, somebody could call up and say, she had the vaccine 2 weeks ago and now she's in the hospital with a broken leg. Now, that obviously would be a silly connection,
right.
But there are other times when a patient maybe gets some other illness, and the whole big question about vaccines and autism, is an ongoing one. But the HPV vaccine is considered very safe and is not one of the ones that has been reported to cause disorders like Guillain-Barré or any of the other types of bad things that happen with some vaccines.
Okay. And then can someone still get cancer if they have the vaccine?
Okay. So yes, the bottom line is yes. And so currently, even if a young girl has gotten the vaccine maybe exactly when she was supposed to at age 11 and 12, and now she's 21 and comes in and says, do I need pap smears because I had the vaccine? The answer is still yes. And actually the recommendation is you keep having pap smears the same frequency as if you didn't have the vaccine. But if you have had the vaccine, the chance of getting an abnormal pap smear that needs to have the evaluation with colposcopy and biopsies and maybe laser or freezing, that risk goes way down. Probably, and the risk of developing warts goes down by 90%. The risk of developing cervical cancer goes down by close to 90%. So right now, the recommendation is keep having pap smears the same as if you hadn't gotten the vaccine, but you're just much less likely to have a problem with it.
Okay. Well, thank you so much. That's excellent information that I think any young woman and I guess young man all needs to know.
Yes.
I'd like to thank Dr. Brawley for being here and giving us that excellent information. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.